May I help you?
Hi, I am here to check in for my operation.
Okay, great. I can help you with that. Have you been here before? If so, can I have your name and date of birth to look up your My Chart?
You mean my charts from home?
No, ma'am. Your Health My Chart.
What is my chart?
Your My Chart is our electronic health record system that we use to store your medical records.
I do not quite understand what you are talking about.
I can have the nurse or doctor explain to you more about our system when you are taken back for your operation. But let's first get you checked in. Name and date of birth, please.
Okay, that sounds good. I am Bertha Dunn and birthday is April 20th, 1954.
Thank you, Mrs. Dunn, for your cooperation. I now have you all checked in. You can have a seat in the waiting room, and someone will be with you shortly.
Thank you so kindly, sir. Did you know about the My Chart that the receptionist is talking about?
Yes! It is their new system that they created to store our medical records.
I must really be the only one who has not heard of this new system. Mrs. Dunn, we are ready for you. How are you doing today, Mrs. Dunn? I'm doing well, hope you are. I just heard about something new, you all's new medical record system. I am not sure what it is though. Yes, ma'am. That is the new system we are using. I would be happy to discuss more about it with you once we get you settled in your room for your pre-op. Sounds great. Thank you. Mrs. Dunn, I hope you are comfortable. This will be your room when you return from your operation. Yes, ma'am. This room will be fine. Now can you tell me more about this new system you all have? You sound very concerned about it. Was there something wrong with your check-in process? No, ma'am. I was just not aware of what a My Chart was when the receptionist mentioned it. No worries. Our new electronic health records system is where we store all patients' medical records through technology. Technology? I must really be getting old. What happened to my medical information being kept in a folder in a file cabinet? Our new system is actually now those file cabinets you are talking about. Your information was entered into the computer under a tab that has your name on it, so that all of your information is in one place. Is my information kept safe that way? Can information through technology be shared? Mrs. Dunn, I answer you that all of your information is kept safe throughout our system, and only authorized personnel can access when needed. It was actually brought in to keep things more organized and a quicker way to access all the records we need to. Wow. I am getting old. Technology is just taking over. Technology is growing fast, especially in the healthcare setting. Mrs. Dunn, it is actually time to take you back for your operation. Are you ready? As ready as I can get. Great. Let's take you to the operating room.
Hi, Mrs. Dunn. My name is Jerry and I will be your doctor today. How are you?
I'll be even better once I get out of here.
I can understand. Are you ready to get started?
Yes.
Great. Let me just look at your chart really quick to check on a few things.
There we go again with this chart. Technology is just too much for me.
You are too funny. This system that we have started using actually has been very beneficial. Every room that you go into in this hospital can easily pull up your information within seconds. Of course, depending on how the internet wants to run at that time.
That does sound like it saves a lot of time.
Also, with our new system, it is set up for very strict privacy so that only authorized personnel can access your information. We strictly abide by the HIPAA law.
Now I'm just learning a lot today. What is the HIPAA law?
HIPAA first stands for Health Insurance Portability and Accountability Act. This law just simply stands for patient privacy. We take pride in keeping all patients' information strictly confidential. We do not share with anyone without your permission or amongst other co-workers outside of this room.
I really like how that sounds. Now I just want to know one more thing.
Yes, Mrs. Dunn, what could that be?
How long until I will receive all of my test results and a summary of the operation?
That's a great question. With our new electronic health record system, they have set up what is called a patient portal. And that patient portal gives you access to all of your medications, test results, lab results, your appointment information, and even summaries of all of your visits.
As soon as I learn to use the computer, I will be good to go.
Wonderful! Before you leave, I can actually set you up with one of computer specialists who assists patients in learning how to go through the patient portal.
That sounds perfect for an old lady like myself. Thank you so much.